Hello everyone, welcome. In this video, we are going to talk about bowel cleansing, what you need to know. Bowel cleansing is a process that clears all stool from your colon. It is needed before procedures such as colonoscopy to allow the doctor to see clearly inside of the colon for any pathological issues such as ulcer, inflammation, bleeding, polyps, and tumor. Inadequate bowel cleansing will hinder the detection of this issue, which can compromise diagnostic accuracy or require the procedure to be repeated. Bowel cleansing is also needed before colonic surgery and rectal surgery to reduce the risk of infection. That is why following the bowel cleansing instruction carefully is very important. Two commonly used bowel cleansing agents are Fortrans and Picosalex. Both are effective, but they work slightly different. Fortrans contain Macrogol 4000, which is an osmotic laxative. This means it draws water into the colon, soften and increase the stool volume, which then stimulate the colon to contract and push the stool out. It usually starts working within 30 minutes, and the effect can continue for 2 to 3 hours after the dose complete. Because of this, you should stay close to a toilet until colon emptying is complete. For adults, the usual dose is 3 sachets in total. To prepare for trans, dissolve 1 sachet in 1 liter of water. No volume adjustment is needed, even for patients on fluid restriction, unless your doctor advises otherwise. If the taste is unpleasant, you can chill the solution or add a small amount of lemon juice into the solution. If your procedure is in the morning, meaning before 12 p.m., take all 3 sachets on the day before the procedure. First sachet should be taken at 4 p.m., second sachet should be taken at 6 p.m., and the third sachet should be taken at 8 p.m. If your procedure is in the afternoon, after 12 p.m., take 2 sachets on the day before the procedure at 6 p.m. and 8 p.m. respectively. The third sachet should be taken on the day of the procedure at 6 a.m. Always follow the timing given by your doctor. Picosalex is a combination colon cleanser. One of the ingredients, sodium picosulfate, is a stimulant laxative. After hydrolyzed by bacteria in the colon, it acts on the inner lining of the colon, stimulate it to contract and push the stool out. The other 2 ingredients, magnesium oxide and citric acid, combine in the gut to form magnesium citrate, which is an osmotic laxative. Similar as Macrogol 4000, it draws water into the colon, which softens the stool and increases its volume. Together, these ingredients work in synergistic to ensure effective and complete emptying of the colon. For adults, the usual dose is 2 sachets in total. To prepare Picosalex, fill a mug with about 150 ml of cold water. Empty 1 sachet into the water and stir until it is fully dissolved. The solution may get slightly warm. After each sachet, drink 1.5 to 2 liters of clear water over the next 4 hours. If your procedure is in the morning, meaning before 12 p.m., complete both the sachets on the day before the procedure. The first sachet should be taken at 5 p.m. and the second sachet should be taken at 9 p.m. If your procedure is in the afternoon, meaning after 12 p.m., The first sachet should be taken on the day before the procedure at 7 p.m. and the second sachet should be taken at 6 a.m. on the day of the procedure. Follow the schedule provided by your doctor. Possible side effects of this medicine include nausea, vomiting, bloating, severe stomach cramp, headache, or electrolyte imbalance. Symptoms of electrolyte imbalance include confusion and dizziness, severe fatigue, muscle cramp, or palpitation. If any of these occur, stop taking the medication and seek medical advice immediately. 2 days before your procedure, start a low-fiber diet. You may eat white bread, butter, cheese, eggs, chicken without skin, steamed white fish, or plain biscuit. Avoid food like fruits and vegetables, red meat, whole grain or high-fiber bread, or high-fiber cereal. 1 day before your procedure, continue a low-fiber diet for breakfast and lunch. After lunch, you should stop eating any solid food. In the evening, start taking your bowel cleansing agent as instructed and drink plenty of clear liquid until midnight. You may drink water, tea or coffee, but should not have milk or creamer added, or fruit juice without pulp. Avoid milk, dairy product, red or purple colored food and drinks, alcohol, and carbonated drinks. On the day of the procedure, continue to take your regular medication as advised by your doctor. Only clear fluid is allowed. However, all liquid, including water, should be stopped at least 3 hours before your procedure, unless advised otherwise. Before your procedure, some medication may need to be stopped or adjusted to reduce the risk of complication and ensure accurate result. If you are taking blood thinning medicine such as aspirin, ticlopidine, and warfarin, or painkillers such as ibuprofen and naproxen, your doctor may advise you to stop them temporarily to reduce the risk of severe bleeding during or after the procedure. For painkiller, paracetamol may be used as an alternative. Some supplements should also be stopped. Iron supplement can cause dark sticky stool that stick on the colon wall and affect visibility inside the colon. Fiber supplement can reduce the effectiveness of bowel cleansing. If you are on diabetes medicine such as metformin or gliclazide, your doctor may advise you to stop them temporarily to prevent hypoglycemic. Always tell your doctor about all medicine and supplement you are taking. You should not use bowel cleansing agent if you are allergic to the active ingredient or any of the excipient. Symptoms of allergic reaction include skin rash or skin itch, swelling of tongue, swelling of eyes, or breathing difficulty. Individuals with certain bowel conditions such as Crohn's disease, ulcerative colitis, bowel perforation, bowel obstruction, toxic colitis, or ileus should not be on bowel cleansing agent as well. Inform your doctor if you are allergic to any medicine or food or have any of these conditions. If you are pregnant or breastfeeding, bowel cleansing agent should only be used when necessary. If you are an elderly, having difficulty drinking large amount of water, especially if you have heart or kidney problem. A split dose regimen may be recommended. This means taking half the dose in the evening on the day before the procedure and the remaining half the dose in the morning on the day of procedure. If the patient is a child, Fortran should not be used. Picosalex may be used, but dose adjustment is needed. An alternative option may be recommended is PEG 3350. So thank you so much for watching. Good bowel preparation is essential for a safe and smooth procedure. If you have any doubt, always consult your doctor. Thank you.